One, Dr. Michael Miyazaki again. Scenario. Patient comes in, they've broken their tooth off. So this patient, John, came in and you could see this tooth fragment over here on the left-hand side of your screen. That is tooth number 6 or the 1-3. He's been missing a lot of teeth and he was biting, eating, and that tooth just snapped off. He had a crown that had been placed there, but this tooth obviously takes a lot of occlusal forces. So I told John, I said, you know what? This tooth is so badly broken down, we should just take the tooth out. And John didn't want to take the tooth out, obviously, because he didn't have a lot of teeth. The tooth that you see in front of that, tooth number 7 or the 1-2 is missing, and 8 and 9 or the 1-1 and the 2-1 are there, and not much more on that upper arch. And on the lower arch, he does have teeth. So he wanted to have something that he could chew against, which I understand. So we went through all the different scenarios, take the tooth out, maybe make some kind of removable prosthetic, but he wasn't going to wear that. So we decided, why don't we just try to save the tooth and hang on to it for as long as we could. And that's what we plan to do. So as we've talked about before, we went through, the PA looked good, periodontally, the bone around that area looked good. But there's some issues with it, right? We just don't have a lot of tooth to retain any kind of restoration. And just occlusally, this tooth is going to be challenged with the different occlusal forces. So we were kind of going through all that, trying to figure out what we should do. Finally, we got in there. We did the root canal. And what I'm going to talk to you about today is the post and kind of the restorative decision tree that we go through. So, I think we should go back and just remember what the purpose of a post is. The post is something we put down into the root, not to make the tooth stronger, but just to retain the core, and the core is there to retain the crown or whatever the final restoration is. So the primary purpose of the post is to retain the core that will support that final restoration. It's not there to reinforce a tooth, because oftentimes we think that an endodontically treated root is just weak to start. And if we have a lot of tooth structure there, I may place a core and not place a post. So many times today, I don't do posts and cores anymore, whereas before, whenever I had an endodontically treated tooth, I'd always do a post. And today, I would say if I do a root canal, maybe 20% of the teeth get a post, because if there's enough tooth structure there, then I just place my core and we're ready to go. So it's not as frequently done as it once was. If we go through the indications, there's a couple things I do need to have. I need to have some coronal tooth structure, and we'll talk about this. That's for the ferrule. The ferrule is there to kind of transfer the forces from the restoration down to the root of the tooth. And I have to have enough sufficient root length so that when I prepare that canal to receive the post, I still have enough sealer at the apical end, usually 3 to 4 millimeters, to keep that area sealed up so that we don't get bacterial invasion again. So the primary thing that I think leads to success, tooth treated endodontically, typically means it's just been through a lot. It's probably started out really bad. There's either a large area of decay. So once we prep that tooth down, there's not going to be a lot of good tooth structure there. So the ferrule is a circumferential ring of sound tooth structure that attaches to the cervical portion of the crown. Typically, we want that to be 2 millimeters. That's like a minimum. And so the ferrule provides bracing to protect the integrity of the tooth, to retain the crown. And if you don't have a complete ferrule, 360 degrees around, it can lead to kind of a variation of how that restoration loads the root structure. So on the left-hand illustration they have on the bottom, where you see the brown, that's where our tooth is. And this tooth would have been broken off at the gum line. Our crown is attached to the post in the core, but there's no ferrule, meaning the crown doesn't really attach to the root itself. It's attached to the core that's attached to the root. And over time, what happens is that patient puts some kind of occlusal force on that tooth, and because none of that force is transferred to the root over time, that crown usually will come loose. Like the crown comes loose or the core breaks loose from the post, and that restoration is just now in the patient's hand, not on their tooth. So the ferrule helps to prevent that. When there's a force placed on a tooth that is attached to the root, again, about 2 millimeters of root, then when the patient functions on that, the occlusal forces are transferred from the restoration down to the root. And that's where we have success. The situation on the left-hand side, you take that tooth, it's really badly broken down, and I call it kind of heroic dentistry because we go in there and we do our root canal, we put the post core in, and the patient leaves with the restoration, or maybe they come back and we put the crown on. Unfortunately, it doesn't last. So that's kind of the heroic dentistry that we sometimes try to do. We know what we should do, but the patient comes back kind of with a sob story. Doctor, if you could just save this tooth for a little bit longer, it's really going to help me out. I'm going to go for a job interview and I don't want to be walking around with that tooth. I don't feel confident. Or I'm going to a family gathering and I really need to have that tooth. And so you try to figure out what can you do to restore that tooth. And I tell you, it's a lose-lose situation. Well, it's a short-term win because the patient leaves thanking you for that tooth, but it just doesn't last. So some of the other considerations is that today, when I go out and lecture, I was with the group about 3 months ago, and it was a good sized group. It was a hands-on course, so it was limited in size, but we had probably about 35 doctors there. And as we were going through the lecture, I asked them, how many of you are using cast post? And I was surprised because at least 50% of the hands went up. And I said, oh, you guys use cast post? And they said, yeah. I said, okay, how many of you used preformed metal post? And about another 20% of the hands went up. And I said, so how many of you use fiber resin post? Then the remaining group raised their hands with that. So what that indicated to me with that group, about 70%, 80% of the group was using some type of metal post. And so the one thing about metal posts that I don't like, and we'll talk about what I like about the fiber resin posts, is just that they're so stiff and that they don't conduct light. So if you have ever had a patient come in and they had, let's say, a PFM crown or maybe even a ceramic crown on their tooth and the gum line looks a little bit darker, one of the reasons why is because a natural root is like a fiber optic. It will, when light hits the tooth, it'll go up the root. And as the root conducts the light up there, the tissue will look lighter, like a lighter pink. When the light isn't conducted up there, it looks a little bit dark, like a little gray. And so when we put a metal post into a tooth, oftentimes the color of that root is affected because the light hits that. The metal doesn't conduct the light up into the root. And so the root and the tissue around there just looks a little bit darker. So that's the case where a patient comes in, especially with like a PFM, because oftentimes when I used to use metal posts, it would be when I had a PFM. And you could tell that the gingival area, the marginal area looks dark, and you get that crown off. And as soon as you take the crown off, I don't know if you've ever noticed it, but now that root looks lighter and the tissue turns pink again. So what I do is I like the posts I place into that to conduct light up into the root so that the tissue and the tooth itself just looks more aesthetic. We have that nice pink of the gingiva, and it doesn't look gray. The other thing that I like is fiber resin posts can conduct some light down into the root area so that as I'm bonding my post into the root and then eventually the resin that will make up the core, when I'm bonding, my light's going down into the fiber resin. So anything like I usually use a dual cure cement, but maybe the adhesive, that extra light just helps to cure the adhesive and it will help to create higher conversion of your resin cement. So I like it because the fiber resin post will conduct light, make the tooth look better. It won't make the tooth look dark and the gingiva look gray. But because the post will conduct light, I think I get better aesthetics and a better bond. Now, the problem with a metal post is that the metal posts are just too stiff. A fiber resin post will flex more similarly like the dentin that surrounds it. So over time, we talked about the occlusal forces. As the occlusal forces are being placed on that root, sometimes a post can cause that root to fracture. Whereas if I have a fiber resin post, it's going to flex with the root and not cause that root to fracture. So stiff materials that go down to the apical area of that root where the root walls are the thinnest have a tendency to fracture. And I see this over and over. This on this clinical example, you can see where the post fractured the root is where the apical end of that non-flexible metal post went down into the root. And so I want a situation where if for some reason that post and crown were to come out, that either it debonded, but it did not fracture the root, or maybe in a rare case, maybe that fiber resin post fractured, but it does not fracture the root. So if the root fractures, like in this case, that's like catastrophic, right? We're not going to be able to save that root, put a new post in there with a new crown. In this case, we're probably just going to have to sacrifice the root and figure out another way to fill that space up. With a fiber resin post, and it does not happen very often. If I think about all the times that I've had to re-cement a fiber resin post with the restoration, like a situation like this, I don't even know. Maybe it happens once or twice a year. It doesn't happen very often if you have that ferrule, right? So, but when it does happen, and I know I have a fiber resin post in a tooth, I know it's just going to be a re-cementation appointment. It's not going to be a situation like this where I've got the fractured root. So I want a post that has a similar physical properties as the root itself. So if you look at this on the left-hand side, it's just an example showing with a really stiff post. All that occlusal load, lateral forces especially, are being placed in the thin apical area of that root. Whereas with the fiber resin post, because the physical properties are like that of the root structure around it, the forces are more evenly distributed within the root. And that's why if you use a fiber resin post, it's very rare. I can't think of an example now where the post will cause a fracture in the root. So this is a photo that I show a lot when we do our lectures, because this is that patient that calls you up end of the day on a Friday, usually around 4:30, saying, hey, can I come in because my crown and my post came out? Usually they just say the tooth came out, right? And so your front desk, being quick on his or her feet, looks up the patient's file, looks up the chart, Mrs. Patient, which tooth was it? That's my front right tooth. Okay, we call that tooth number 8 or 1-1. Check on your file, you look it up, and your front desk sees that it's a root canal tooth and it has a post and a crown. Should be a slam dunk cementation, right? Don't have to numb the patient up. Just going to take the post and crown out, clean it up, and just re-cement it. So your front desk tells the patient, okay, it's 4:30 on Friday. Why don't you head on down to the office and we'll get that taken care of for you. And all of a sudden you look at your schedule and something pops up on your schedule. 4:45 emergency patient, tooth number 8 out. So what do? Is you go to the files and you look up to see what tooth number 8 or the 1-1's all about. Oh, it's a root canal tooth. So should be able to re-cement it, right? The team's ready, gets the operatory ready, but it's going to be a slam dunk, pretty quick appointment, and you're going to be headed home. Well, in this case, what happened was we had a tooth that was restored with a metal post, and look where the root fractured. It fractured where the apical end of that post was. So that's where the root structure was the thinnest, and I had this really stiff metal post in there. And now this is not an easy fix. We've got to explain to the patient what's going on, what the options are, and then we've got to fix it up. So again, that's why I like fiber resin posts. Fiber resin posts to me, they're easy to place. We bond them in. When we bond it in, it seals up the coronal aspect of my root canal, so bacteria can't get up and down that area. It conserves tooth structure because what I do is I place a very passive, usually like a parallel-sided post. And today I don't try to place the biggest post I can place into that root. It's usually a smaller post so I can conserve more root structure. I like these fiber resin posts because they behave more like dentin. It bonds to the tooth. It bonds to my core buildup material. If I have to, I can drill them out usually. So they're retrievable. They're going to be the weakest link in this. So the resin post isn't going to cause the root to fracture. If anything, it could fracture, or maybe it debonds. They conduct light, so aesthetically the soft tissue is going to look better. They're aesthetic because of that too, because they conduct more light and they don't gray that area up. Because if you use a metal post, just because it's dark, it's gold or it's silver, that's going to mess up your aesthetics if you're using a highly translucent ceramic restoration. And yet they're radiopaque. So when we take our radiographs, we can see that there's a post in there. It doesn't show up as just a void. One of the posts that I use are the parapost. They're color coded, parallel sided, so they don't put a lot of stress on the root. 0.04 taper design, so we can prep the canals very conservatively, and they have retention in the area that goes down into the root, and they've got retention and anti-rotational surfaces on the coronal portion where my core buildup is going to be placed. So posts like these, I really like. They're easy to use. We can bond them in, and I don't know. It's everything we talked about. They're not going to fracture the root. They're going to conduct light, and they just work really well. So 3 keys to long-term success is make sure you have that ferrule. Make sure that whatever post you put into that root has a similar physical property as the root, that you can bond everything together. I think of it as a monoblock. So I'm taking a fiber resin post, bonding it with resin to the root. Then I'm taking resin composite to build the core up that then bonds to that resin post. And then I'm going to bond the crown on top of that, and it all kind of becomes one because it's joined together, not cemented together with cement layers in between, but bonded together. So I just feel like that gives me a better outcome. So for fiber resin post, we get the ferrule. And if you use a metal post, you want to have the ferrule. But that's where the similarities start to differ, because a fiber resin post is physically more like the natural tooth, whereas a metal post is just too stiff. With a fiber resin post, we're bonding everything together. With the metal post, we're just using cements to cement things together. The fiber resin posts are going to be more aesthetic. The metal posts, not so much. So that's why I like something that's resin. The ideal dimensions, again, is we should have a 2 millimeter ferrule at the minimum that our crown will adhere to, that part of the tooth, transfer the stresses down. And at the apical of the tooth, we do want to leave some gutta percha and sealer down there, usually about 3 to 4 millimeters. So we don't want to overly remove the gutta percha and have any kind of bacterial reinvasion. I like to have my posts to be as long as they can be. Usually a minimum amount is whatever the height of the crown is from the level of the bone up to the coronal portion of that tooth. I like to have at least that much post in the tooth when I can. And then we just bond everything together. And then just remember that, we've talked about this all the time, but just the occlusal forces, that by having the ferrule, we have better retention against the lateral forces. But then just overall, as the patient bites a tooth that's had a root canal where there may not be a lot of tooth structure left after the procedure and the restoration is fabricated, just try to make sure that the vertical forces are placed on the tooth and try to minimize the lateral forces. It's just easier on the tooth. So I try to verticalize the forces. So the thought process is, again, in the big picture, before you even do the root canal, is, hey, if I do the root canal, can I do a post-core and a restoration? Is it going to be able to be supported with that ferrule by the tooth structure? Once we get the restoration there, is the patient going to be able to maintain that restoration? Are the hard and soft tissues going to be able to be supported, clean? We're not going to violate the biologic width trying to gain that ferrule? Will the patient be satisfied with the final aesthetics once we're done? And many times, as I mentioned, that's why I like the fiber resin post versus a metal post. What type of functional forces are going to be placed on that tooth? If it's, let's say, central in the front, we know there's going to be lateral forces being placed on those teeth. And if I cannot get that ferrule, then maybe this is a tooth that we are not going to try to save and restore. One of the things that I'm not going to talk about in this presentation, but often something I think about is there a way that we can gain ferrule? So we'll talk about that at a later time. Um, is a post even going to be necessary? Do I have enough tooth structure where I could just take that tooth structure, bond in my core, and place a restoration over the top? And what is the long-term prognosis? Just taking all of this into account, what's the long-term prognosis of that tooth looking like? So if everything looks good, then let's go ahead and do the root canal. Let's do the post-core buildup and place our final restoration. Anyway, I hope this just gave you a few ideas to think about. Uh, it's really good to see you. If you thought there were some good ideas there, hit the like, hit subscribe so that you know when we have another video program coming out. And I really appreciate you being here. Remember, we're trying to build a community of like-minded individuals, trying to do the very best we can for our patients. There, in October, there will be a program co-sponsored by Vista Apex Solutions, and Dr. Kolnick is going to be presenting this on the East Coast, and we'll put some information up here. But if you love endo and you want to know some of the latest and greatest, like how lasers fit into the treatment today, this will be a program that you want to attend. If you use the code that's attached to this program too, you will get a discount. You'll save some money, have a great time, great facility, listening to a great speaker, and gain some great information. So anyway, I look forward to seeing you in the next episode. Thank you very much.